Welcome back to another edition of Govan CPR and First Aid Tips. Today we're going to be discussing our seizures and how you should handle it. Now there's grand mal seizures and petite seizures. Grand mal seizures last up to about 2 minutes. Petite seizures, they last up to about 15 seconds. There are different reasons that a person could have a seizure. The most common one is epilepsy, and I want you to think of that as like a lightning storm in the brain. A lot of different electrical activity going on in the brain. Or it could be caused by trauma to the head or withdrawal from alcohol. A myth that I do want to dispel is do not put anything in a person's mouth if they're having a seizure. A lot of times people think that a person can swallow their tongue if they're having a seizure, but you can't swallow your tongue. Your tongue is permanently attached to your jaw, so you're not going to swallow your tongue. If you do stick the object in the person's mouth while they're having the seizures, you have the potential to break their tooth, or the object could break in that person's mouth. They could swallow it and choke. So do not stick anything in a person's mouth if they're having a seizure. Your job is to make sure that the area is clear and that it's safe so that person having a seizure does not hit their head or their body on anything and cause further injury. If they're having a type of seizure where they're having muscle constrictions, do not try to restrict their muscle movement. Let them seize. Once they're done, I want you to put them in the recovery position. That's one arm up on their side with one leg bent, so that if they have any excess fluids in their mouth, maybe extra saliva, maybe they bit their tongue or their cheek and they're bleeding, that fluid can drain out the side of their mouth and they won't choke. In any case, call 911. Even if that person has a history of seizures and they're usually okay, make sure you get professional help on the way just to make sure. Now there are different types of seizures. Alright, grand mal seizures and petite seizures. Also, there are silent seizures and febrile seizures. Febrile seizures are usually the ones in infants when their body temperature gets above 108 degrees. Alright? Silent seizures, they're going to look just like this. No muscle constriction, they're just going to stare at you just like this. Alright? They may come out of it, get right back to doing whatever they were doing, or they may come out of it exhausted also. In both cases, those people can hear you. Alright? They're conscious, but they're not going to be able to respond. So, the person having a seizure, your job is make sure that the area is clear, call 911, and once they come out of it, put them in the recovery position. Look for any type of head injury. The most common injury in a person having a seizure is head injuries due to the fall. Alright? Now they may even display some signs of mental illness before they have the seizure. It could be hallucinating, it could look schizophrenic or bipolar. It just depends on what part of the brain that seizure is affecting. Alright? Now there is a thing called a state of aura. So people who have experienced seizures in the past, they feel this sometimes. They feel that they're going to have a seizure. It's a feeling that comes over their body. Not sure exactly what it feels like, but they know. It can happen up to about 5 minutes, all the way up to about 15 seconds before they had that seizure. If a person tells you that they're going to have a seizure, believe them and prepare that area for them seizing. For more tips or comments or trainings, contact Govan CPR and First Aid. And follow me at Govan CPR.